The healthcare industry is in a constant state of change to create an environment where everyone, hospitals, physicians, insurers, and patients all work together in an affordable, patient-centered model. Accountable care organizations are at the center of that change. ACOs are networks of physicians, hospitals, and other healthcare providers who share financial and medical responsibility for your care. Together, ACOs focus on quality of care, population health management, your care experience, and cost. In short, ACOs collectively work to ensure that you receive the highest quality of care at the lowest possible cost. They are the result of a shift from a volume-based care model to a value-based care model. So what does that mean? In a traditional volume-based healthcare environment, the system was designed to pay physicians based on the number of patients they saw and the services provided, rather than based on meaningful patient outcomes. Imagine if your hospital was a basketball team and told their players that they would be paid for every shot they took, regardless of whether they made a basket. That doesn't make sense in basketball, and it certainly doesn't make sense in healthcare. Traditional environments also put the burden of care coordination on patients. It's not unusual for you to have a team of specialists all providing different types of care, working from different locations, prescribing different medications, and focusing on different healthcare needs. And unfortunately, those providers may not always communicate with each other. As a patient, this can be confusing and frustrating, and it may lead to repetitive tests, miscommunication, or even conflicting medications. In a value-based model, the focus shifts to issues most important to you: quality of care, a positive healthcare experience, staying healthy and active, and lowering your costs. So how does it work? ACOs enter into value-based contracts with insurance providers. The value-based agreements include specific performance measures centered around quality and cost. If the ACO reaches the performance measures, including lowering the total cost of care, they are financially rewarded with shared savings. If they do not meet the measures, they miss out on the savings and may even be financially penalized. Quality measures focus on services you need most, like preventive screenings, immunizations, disease management, and medication management. The ACO collects and analyzes data from a number of sources, including electronic medical records, insurance claims, and pharmacy records, to help address your individual needs. Plus, we can identify trends shared across the entire patient population and act accordingly. This analysis helps us improve your overall care and shift from a reactive environment where we only treat you when you are sick to a proactive approach focused on keeping you healthy. In this new and improved model, the burden of care coordination shifts from you to the ACO and its providers. We help your provider identify when you are due for a preventive screening or exam, contact you if you haven't been to your primary care doctor in the past year, or provide you with care management and coordination following a trip to the emergency room or after a hospital stay. ACOs can even use predictive analytics to identify which patients are most likely to get sick or need more intensive care management, giving providers a potential chance to intervene early and prevent worse outcomes. When you receive care at Methodist Health System or Nebraska Medicine, you are part of our joint ACO called the Nebraska Health Network. Our network includes physicians, specialists, and advanced practice providers at Methodist, Nebraska Medicine, and a number of independent community clinics. We have locations throughout eastern Nebraska and western Iowa. We work together to ensure that you receive the highest quality of care at the lowest possible cost. For more information on accountable care organizations or to view our patient resource library, visit nebraskahealthnetwork.com.